Good afternoon. County Executive Rich Fitzgerald here at the Allegheny County Health Department with Director Dr. Deborah Bogan to give our weekly update on the coronavirus pandemic. As we've been saying over the last couple of weeks, the cases continue to drop. The percent positivity continues to be at a better level than we've seen. Hospitalizations, fatalities, certainly better than December in January. So the fact is people wearing their masks, social distancing, going through the proper protocols when they're going to work, going out to recreate, etc. has been much better. And obviously the fact that more and more people are becoming vaccinated is very helpful. What we've been saying is there's light at the end of the tunnel, and that light seems to be getting brighter. We're obviously not there yet, but some of the announcements that continue to come out of from the federal government, the Biden administration, yesterday just announcing President Biden that there would be 400 vaccines, 200 from Moderna and 200 million from Pfizer, 200 million from Moderna by May, and then another 100 million, which would take us to 600 million by July. And that is before the J&J Janssen one gets approved or any other ones get approved moving along. So that's the good news. And we continue to see folks who are getting the vaccine. And we opened the Castle Shannon operation for the County Health Department, although the County Health Department, again, and Dr. Bogan will talk about this, only gets about 10% of the vaccine distribution that comes into Allegheny County. So in any event, there's some good news on the horizon. Stay tuned with the information that we're going to be doing. We want to keep those cases low, keep people healthy as we can while we're waiting for the vaccine to get into more and more arms throughout Allegheny County. And with that, let me turn it over to Dr. Bogan. Dr. Bogan?
Thank you, County Executive. Good afternoon, and thank you for joining us. Case counts in Allegheny County remain steady, which is very encouraging. Our average cases per day is 182, which is a drop of about 15 cases per day compared to last week. And our positivity rate remains stable at 6% according to the state. Last week, I announced that the State Department of Health had detected one case of the UK COVID variant in Allegheny County. This was the first and continues to be the only case of the variant reported thus far. That doesn't mean that it's the only case. As far as I've said before, I suspect that the UK variant and potentially other variants have been and are present in Allegheny County. As such, we mustn't let down our guard. These variants spread more efficiently, so it's vital that we all wear a well-fitting mask that covers both the nose and mouth. Also, we must remember to keep our distance from one another, to avoid large groups, to limit our trips out of the house, and to continue to wash our hands. We know that these steps limit the spread of COVID-19 and protect ourselves and others from the virus. I have one other note to make about data before moving on to vaccines. You may have noticed a change to the map on the dashboard on the Health Department's COVID-19 webpage. Since the start of the pandemic, the Health Department has mapped COVID tests, cases, and deaths by municipality and neighborhood to allow people to understand the spread and the toll of COVID-19 in their communities. To map tests, cases, and deaths, we use the home addresses of individuals provided in the Pennsylvania NEDS database. In the past, when a result in NEDS did not have a home address, we used the address of the testing provider. Over time, this resulted in some municipalities, specifically those with either hospitals or major testing locations, having test and case numbers that exceeded expected rates for their populations. To address this issue, this week, the Health Department removed about 20,000 tests, 1,000 cases, and 20 deaths without home addresses from the map. And going forward, we will not add to the map tests, cases, or deaths without home addresses. However, these data are still included in the test, case, and death counts at the top of the dashboard. In addition to making this change to the map, the Health Department identified specific health systems and laboratories with missing addresses, and we are working with them to correct the missing data going forward. Now onto the vaccine. You may have heard the state's announcement earlier today about a shortage of Moderna vaccines. We are working on a plan that will address this to ensure that those who received their first doses of vaccine from the health department will also receive their second doses from the health department. I'm confident that the health department will be able to honor those second doses, although as suggested by the state, this may mean moving back the second dose by up to a few weeks, but still within the CDC guidance for second doses of between 28 and 42 days. As our plan to address this becomes more concrete, we will share it with you all. I also want to be clear that the first and second doses of Moderna vaccine are identical, and this issue with first and second doses pertains to supply chain management, not to different medications. As I said, the health department is only one of many vaccine providers in Allegheny County. As the director, I only oversee and direct the distribution of the vaccine sent directly to the health department, and we receive only about 10% of all the vaccine sent to the county. We continue to operate in the Monroeville vaccine clinics, and starting yesterday, the county opened a second vaccine clinic in Castle Shannon. In its first day, 470 people were vaccinated, and that will increase to about 700 per day for the rest of the week. I want to thank the Allegheny County Department of Emergency Services, led by Matt Brown, who stood up and are running the Castle Shannon site. We are extremely fortunate to have these professionals as partners in vaccination planning and delivery in Allegheny County. Our initiative to reach senior living facilities got off to a very good start last week. We vaccinated seniors in buildings in Homestead, Turtle Creek, Clariton, West Mifflin, and the Pittsburgh neighborhoods of Lincoln Leamington and the Hill District. In total, about 400 people were vaccinated. And depending on the availability of vaccine, more buildings in more communities will be scheduled for the coming weeks. The health department wants to thank our vaccination partners who held or are planning community-based vaccination events, including those helping to reach senior living facilities. We continue to develop best practices along with partner organizations to reach diverse communities. One final note before I end, fish fries start this week, and as I mentioned last week, they will look a little bit different than in prior years. Please be safe when patronizing your local fish fry, opt for takeout, wear a mask, avoid large groups, and keep your distance from others. So thank you all for joining us today. Please remember to stay safe and be kind. Thank you.
The first question that we have today is from KDKA. Were any of the providers who gave the second dose of the Moderna vaccine as the first dose in Allegheny County?
So I can't answer this for other providers because, as I mentioned, I know about the vaccines that come to the health department. We only get about 10% of the doses, and we are not involved with the distribution of who else gets vaccines. The health department started giving second doses at the end of January, 4 weeks after we started vaccination at all. And we have segregated our doses for first and second doses throughout. So we have not given away those designated as second doses as first doses.
This next question is from WPXI. Are you hopeful the state will relax some of the guidelines for restaurants and businesses in light of the declining case numbers?
Well, my sense is that will be coming in the weeks to come. I don't think we're there just yet. But as we continue to see case numbers decline and remain steady, as more and more people get vaccinated, I definitely could see an opening of some of our entertainment venues where you could have a certain percentage of people going to a sporting event or a show or those type of things. And I think you may see, again, and the governor I'm sure is taking a look at this with the Secretary of Health, what can be done as we head into March, particularly if the vaccine levels start to reach a certain level. So I think that's going to be coming. When that will be coming remains to be seen. But as I said, we the light at the end of the tunnel seems to be getting brighter. We seem to be coming towards a good point. We're not there yet, so we can't relax just yet, but hopefully that will be the case.
The next question is from both Tribune Review and KDKA. Are there more clinics in the works, more pods in the works? And do you have any specifics about where or when they might be or when they might open?
Well, those plans are still being formulated, and the health department and Dr. Bogan and her team continue to look at sites. You may have seen that one of the North Hills sites, Ross Township, voted last night to accept if we have a need for those type of places. And we've been very grateful that so many organizations, governments, schools, et cetera, have reached out to offer those sites. And again, as we need, it's a kind of a need-based thing. As we get more product, more vaccines to distribute into people's arms, that may be the case. But as Dr. Bogan indicated, the health department themselves only gets about 10% of the vaccines that come into Allegheny County. 65%, almost 2/3, go to the hospitals directly, and I'm sure they will be setting up sites as well. So we don't want to duplicate geographic areas where they're doing. I think Dr. Bogan had mentioned that going into underserved communities and filling gaps has been the role so far of what we've been able to do. The pop-up sites that have had in the Hill District and Lincoln Leamington and Clairton and Homestead, West Mifflin, Turtle Creek, and other communities are some of the things that will continue to happen. But again, and I mentioned the percentage, about 15% or so go to our pharmacies, and then the rest go to the FQHCs and some of the other small doctors' offices. So there's a wide range of distribution points that we go through. So we're coordinating and communicating, and the county manager and the health department are certainly looking at sites throughout the county.
The next question is from WTAE. We keep hearing about the spreading of the variants, and yet overall cases have been falling for several weeks. Is another spike looming, or are we seeing the results from vaccinations and people adhering to safety measures?
Some of that is hard to answer, but I am very happy when I go out to see people that are really following the safety measures, and we know that that works. So maybe that is, I hope that that's what explains most of this. I just wanted to also note that our testing numbers are substantially down, and when we don't test, we don't identify cases. So we're hoping that people who are symptomatic or have exposure are coming in and getting tested. And I think it's really too soon to say what the impact of the vaccines are on cases at this point. We'll be keeping an eye on that, but we don't really have those data available at this time.
This next question is from KDKA. When do we vaccinate all of phase 1A, and can you tell us what percentage of people over 65 have been vaccinated?
Great question. I don't have an answer for the when we'll be vaccinated all of phase 1A. I will say that we have looked at among vaccines that the health department has administered to date, about half have gone to people of 65 and older. And again, when we first started to vaccinate, we were told to vaccinate those that were frontline healthcare workers, which is what we did. So, but in the last couple of weeks, we've really focused on 65 and older, and about half of our doses have gone to those 65 and older so far.
This next question is from WTAE. Do you think the state's expansion of Group 1A to align with federal recommendations contributed to some of the supply issues that we're seeing?
The change in guidance created more demand. It didn't affect supply. And again, because of the supply issues, we have, at the health department, and I've given that logic before, why we focus on 65 and older. Vaccinating the people 65 and older are at greatest risk for hospitalization and death, so that's where we focus. But again, the change in the expansion of Group 1A didn't affect supply, it really affected demand.
This next question is from KDK, and I believe that you already touched on this briefly. How many vaccines have gone to UPMC and AGN as compared to the small pharmacies or PCPs?
Well, what we do know is that our health